Keeping an eye on your vision health. Here with what you can do to keep your eyes healthy as you age is ophthalmologist Dr. Michael Cooney. Good morning, doctor. Great to have you on this morning.
Good morning, Stephanie. Great to be here.
So how can people really distinguish between what might be a normal change in vision versus maybe a serious medical condition?
Well, that's a great question, and the simple answer is oftentimes they cannot. So if you're having a change in vision or the kind of standard of care of anyone after age 50, you really need to get in on an annual basis to see an ophthalmologist for a full dilated eye examination, because what you may interpret as a change in vision and a simple thing may be something completely different that needs treatment or could result in significant vision loss.
So just like with a lot of health-related situations, you know, we really don't want to wait until it's too late, right? Kind of stay on top of things is the best advice.
That's right, and oftentimes we do wait until it's too late. So, you know, preventive treatment and catching things early is certainly much better than catching them later. And that's, you know, particularly true with what we're here to talk about today, which is macular degeneration.
Well, and I've heard a lot of people talk about wet age-related macular degeneration. What exactly is that?
So macular degeneration, or AMD for short, is the leading cause of vision loss in people over the age 50 in the United States. And what it affects is it affects the retina, which is the part of the eye that's like the film of a camera, and the macula is the part of the retina that's responsible for your good straight-ahead vision, so seeing faces, reading, watching TV. In wet macular degeneration, what happens is, due to aging changes that accumulate in that area that patients oftentimes don't even know they have, a blood vessel can start to grow, which can cause a very rapid and abrupt destructive loss of the straight-ahead vision. So people lose their vision altogether straight ahead. The good news is, if caught early, there are good treatments for that. For example, there's a medication called Lucentis, which is one of the first medications approved by the FDA for the treatment of wet macular degeneration, which in about 95% of patients can stabilize that condition, and in about 40% of patients can actually improve the vision, which has been a revolutionary treatment since we've had this since 2006. But patients need to maintain regular follow-up with their ophthalmologist if they're undergoing treatment with Lucentis. And they obviously need to check with their medical doctor to make sure that that medication is right for them.
And I'm glad you said that there's good news. I was hoping there was good news with this. As we close here, what is the best way to really preserve our eye health as we age, doctor?
I think, you know, the concept of general wellness, taking care of yourself, eating well, exercising, all the things that you would generally do for taking care of your heart, which is kind of an easy way to think about it, are also good for eye health, particularly retinal health. So losing weight, exercising, certainly not smoking, all these things go a long way. Eating well, good nutrition, and then obviously what we started with, which is getting in and making sure and being screened for anything that's going on in the eye, so that you're treated, if you have something, as soon as possible.
Is there any place, maybe one website you can send us to online to learn more about AMD and just preserving our eye health as we talked about today?
Yes, Stephanie, there's a great website, preventblindness.org, which has a wealth of additional information on what we talked about today.
Doctor, thank you so much. So great to have you on the show. Thanks for joining us today.
It's been my pleasure. Thank you.
We will have more on